Hello, I'm Dr. Ghodsi. I practice at Marietta Memorial Hospital and at Selby General Hospital. I'm a neurosurgeon. I've been in practice for almost 20 years. We do a lot of spine procedures. We do a lot of procedures that are on the edge of technology and science. Sacroiliac joint dysfunction or SI joint problems have been missed for a long time. Most of the patients that come to our office are obviously non-surgical, but a certain percentage of them that come with back pain have actually SI joint problem rather than a lumbar or a thoracic or a sacrum problem. About 30% of the patients that we're seeing now have some type of SI joint dysfunction, whether it's their primary problem or a secondary problem. So when the patient comes in to see me, they give me certain clues immediately by their demeanor, how they present themselves. When I walk in the room is very telling. They try to keep pressure off that area of their joint, trying not to aggravate their pain. We have become very good at looking for these things and diagnosing it. There are certain tests that we can do, gives us a better idea whether this is an SI joint problem or not. SI joint is very tough to diagnose radiologically. Sometimes there can be some degeneration that shows up, but this is primarily a diagnosis that we make clinically. We have become very good in the office at diagnosing it, but our clinical exam, and then we do our confirmation tests. So the patients are usually sent to interventional pain management for a confirmatory test. This is what's called a diagnostic test. We're very interested in seeing how the patients do in the first few hours after the injection. At that point, we send them for treatment with the interventional pain people. And we tell them to exhaust all conservative treatment. If they come back and say, things are helping me, but it's short term, it's not lasting, or they say, this didn't help me, the diagnostic test helped me for a few hours, but the other treatment hasn't helped me, an SI joint fusion may be an option. Once we decide that the patient is a surgical candidate, then we obviously get them scheduled. We talk about the preoperative visit, look at all their other issues, make sure there's no other things that precludes the surgery, and then proceed with the surgery. We do the procedure through a minimally invasive technique from the side, a small incision, maybe 3 centimeters or a little bit bigger than an inch. The procedure is done through a side incision, and it involves placement of stabilization pins into the spine from the side. It's done in the main operating room. Patients can go home either the same day or the next day, depending on their age and other issues. As I said, usually they go home within 24 hours of the surgery. We like to get them into some physical therapy fairly quickly, within 3 to 4 weeks from the surgery. We like to get them moving immediately. We like to keep them active so there's no other complications. Initially, when I started doing this procedure, I was using standard circular devices that went across the SI joint and stabilized the joint, and we had some success with that. The latest data that has come out, and there's now 5-year data supporting this procedure. We have great outcome in the literature, and we have great outcome ourselves. The latest data supports the use of these triangular pins that can be placed from the lateral approach. And I think these allow an additional stabilization by their shape. They're porous, so they allow the bone to infiltrate within and cause the fusion. And the success rate has been much better since we started using these devices. I've had patients come to me and say they're playing tennis, which they never could do before, or playing pickleball, or even racquetball after the surgery, where they could not do that before the surgery. I've had patients that have come to me and say, you have given my life back to me. I think that's very rewarding for us. If you feel that an SI dysfunction or an SI pain might be your issue, maybe it's been treated, or maybe it has been not diagnosed, we would love to evaluate you. You can call the office and set up an appointment. We would see you, do a full history and physical, and once we make that diagnosis, we will guide you towards the appropriate treatment, whether it be non-surgical or surgical treatment.